everyone on that RSVP'd. So welcome to the City Health Dashboard. And today we're going to be going over how to use the site and things to expect from us as a new city on the dashboard. So again, just a reminder to go ahead and put your city in your name if you can, or if you're with the City Health Dashboard, put that in too, so folks know who you are. And I think we'll just get started. We just have an hour together, and we actually have a lot we want to show you with the site and leave some time for questions. So if we're going too fast, let us know, because that's usually the problem. We usually zoom through this, and we want to make sure that you are comfortable using the dashboard and the data. So let's get started. Again, congratulations. We're really excited to be adding smaller cities to the dashboard. It's a real goal of ours as kind of a project, and we are welcoming 29 cities listed here. And again, we're just really excited to be able to share access to this data in order to make healthy changes in communities. So we'll start just kind of by a little background about the dashboard. Get into some nitty-gritty of how to navigate the site, use the site and the data, talk a little bit about how the dashboard has been used in other communities, just to inspire some impact that you might be able to have, and then what to expect from us and some next steps. Because we have so many people on and so many new cities, we won't be able to do full introductions, but we really do want you to feel like kind of a cohort of peers that you can turn to each other with questions on data issues for smaller places. You are like a distinct kind of geography, and having smaller population places presents different issues with using data. So and we would love to help build that support, but we won't have time for you all to connect a ton on today's call. So feel free to introduce yourselves in the chat as you are already doing, and connect as you need there in the meantime. Okay, so as you likely know from our communications and the challenge that you applied to, the City Health Dashboard's goal is really to help cities across the country leverage the power of data to improve health and well-being of everyone in the community. And we are doing that by providing measures of health and the factors that shape health, and really these drivers of health equity to guide local solutions for now over 900 cities across the country. And this launch was really exciting for us because we launched in 2018 with only 500 cities, and over time we've been really adding places and pushing that boundary to really add smaller places. And this was a really exciting way to get to work with more of you. And we don't do this in a vacuum. As you know, we're housed at NYU Langone Health in the School of Medicine here, which is in a giant health system in New York City. We're considered an academic medical center, but we really care about population health and providing this data really to show health outcomes, but how those are shaped by social and environmental issues in communities. And we've developed the tool over the past years with a number of partners. We worked with the National Resource Network, ICMA, which is International City and County Management Association, National League of Cities, and NACCHO, the National Association of County and City Health Officials. And we really have worked with them as well as pilot cities that we worked with to create the metrics that we add to the site, make sure it's easy to navigate and useful. And we want to continue improving the site. So, your feedback on this front is always welcome as well. And as you have hopefully explored your data a little bit, you'll see that you can use the dashboard in a lot of different ways, comparing health gaps across neighborhoods. And here you're looking at life expectancy by census tract in a portion of Columbus, Ohio. And you can see in these 3 census tracts right next to each other, life expectancy goes from only 60 years in one tract, jumping up to 80 and then back down to 68. And this is like a 2-mile stretch of road between these places. So it gives you a lot of information in one view that is hard to get. And using the maps and the scale bars and data in different ways, which we'll get into, is just meant to help you kind of be able to dive into the data in different ways. The other nice thing about the dashboard is that because we use national data sets and parse it down to the local level, the measures are the same in all the cities on the dashboard. So all 900 cities are essentially using the same underlying data to create the metrics that we put on the site. And while, local data dashboards are really valuable, with locally collected data, what's one of the really special things about the City Health dashboard is that cardiovascular disease deaths is measured the same way, across all the cities. And then on the policy front, using this data to really think about programs and policies to help target your local resources, set priorities. We're really interested in what you do with the data once you've been able to use it. So right now we have 40 measures, I think. It's 40 or 41. We're adding 2 more in a couple of weeks. And like I said, we really focus on using those national data sets so that the measures are the same across all cities. We are an academic medical center, a division of epidemiology, so we really care about the methods underlying the original data collection. But we also want the measures to reflect public health priorities and importantly, be amenable to city level intervention. We've been exploring measures related to climate change. And while we know that that's really important, there's some things that a city manager or a local health department or a community organization just isn't going to be able to make an impact on. And so we only want to show measures as much as possible where their really local impact can make a difference. We do update the data regularly, and the measures are balanced across 5 overarching domains, which are shown next, I believe. Oh, not quite next. We'll get to that in a second. So the selected cities, which are all of you, will have access to your city's data on the City Health dashboard and all the other website features. So you're just built into the full dashboard now. You get support from our team, and as you use the data and hopefully put it to good use, we're excited to show other users of the site how you're doing that. So a featured blog or an impact story on the site, we would love to work with you on in the future. So here are those measures and the 5 domains. And just to kind of orient you, because there's a lot we're looking at here. So there's just one measure that is only at city level, the dark blue one, neighborhood racial ethnic segregation. The orangish measures are available both at city and neighborhood level or census tract. And then the ones that are grayed out are unfortunately not yet available for smaller cities. And this is because we pull data from the National Vital Statistics System, which they are very particular about the data that we get. And when you get to smaller population places, there are issues with identifiability and privacy. So we are always working with them and have a special data use agreement to get measures and data. But and as we're able to get additional data, we will add it just to your to the site as it's available. But these ones that are grayed out are not yet available. And then just as a side note, as we do add other measures that might be available for smaller cities, you will get those as well. So that's kind of a special benefit of just being built into the City Health dashboard in this way. So I'm going to turn it over to Sammy here to actually walk through the site with you, and I'm sure questions will pop up on how to do this or how to use that feature. So you can put them in the chat. We'll try and address them, but Sammy might get to it, and then we'll definitely have time for questions at the end. Go ahead, Sammy.
Great, thanks, Becky. So this is the City Health dashboard site. Hopefully all of you, some of you have already gone on and started looking around, but our site, as you probably know, is completely free and accessible to anyone as long as you have an internet connection, just cityhealthdashboard.com, very simple and to the point. And so this is the homepage, and to kind of get at or to get into anything, to all of our features, you just start by searching your city. I'm going to look at Charlottesville, Virginia, one of our new put us on the map cities. And you're kind of brought to this selected metric or this metric selector. And this shows all of the metrics that Becky just spoke about or just kind of showed on her previous slide. So you could click into any of these measures if you kind of know what you want to explore. But if you are not quite sure, you want to see a more high-level overview, you can just click into Charlottesville's overview or your city, whatever you're looking for. And you kind of are taken into this, like I said, a high-level overview snapshot, 360-degree view of how your city is doing across all of the metrics and all of the domains. And it's pretty clear. You can see, you know, which data that you currently have or which metrics you have available, which metrics are not yet available. We try to make that clear for you. And you can just see, you know, if you click into any of these measures, you're able to see like kind of like a quick 411 about, you know, what the measure is, where it comes from, the source, the years of collection that we have for the city, your city's performance at a snapshot, and then a thumbnail of the city map. So again, it's really kind of front and center, easy. You just kind of scroll to across each of the domains, and you can click into anything. And all of these all of this is kind of a hot link. And if you click anywhere, it takes you into the metric detail page, which I will show you in just a moment. But I also want to just bring your attention to a really amazing and powerful feature that we have, which is we have these demographic maps and tables that show both the city and the age and the racial ethnic makeup of your city. And it's not just the 5 major racial ethnic groups. We really dig into, for our Asian and our Hispanic racial ethnic groups, we go down to the subgroup. So you can see in this tabular format, again, the 5 major racial ethnic groups here, but you can click into this plus sign for our AAPI folks or our Hispanic folks, and you can see the different breakdown of subgroups. So you're able to see what the percentage of the Mexican population in your community is versus the Dominican population versus the Cuban population. And so it's getting really nitty gritty into understanding or helping us understand, you know, who is actually living in our city and where are they living. So looking at demographics by census tract, we're able to see that all of that same information in map format. So I will just click into Hispanic. So you can see the kind of pockets or the neighborhoods where there's higher density of Hispanic residents. And for this map, the darker colors indicate greater density of whatever racial, ethnic, or age group you're looking at. And so you can see the general Hispanic population here, but you're also able to dig in again, and I'll just look at Mexican and see where those Mexican residents are living in the different neighborhoods in Charlottesville, for example, here. And then you can click into any of these to see the actual percentages, and those percentages will get pulled out to the side. And this map is a similar, you'll see something similar on our metric detail page, which I will show you right now. So let's just say we want to look at children in poverty. We can see, and just a note for across the board for all of our measures, all of our cities, all of these metric detail pages will look the same regardless. Of course, the information will be a little bit different, but the pages, the symbols, the images will all be the same across all metrics, all years, all cities. So once you kind of get acquainted with one, you really know how the site functions, you know, across all of our different features. So if we're looking at children in poverty, you can see again that information about the metric here. You can click in to see that information that we had seen on the city overview page. And then for about, I think at this point, more than 3/4 of our measures, we have multi-year data available. And if that is an available feature, you'll be able to toggle between years here. And most of our measures where we do have multi-year data available, a lot of those measures go back to 2013, 2014. So you're really able to see how your city is doing across time and kind of identifying any trends. So we're looking at children in poverty in 2020. and then scrolling down the page to, you know, the bulk of the information. So this scale bar represents the range of values for that metric. The lighter colors are indicated or indicate better outcomes, whereas darker colors indicate poorer outcomes. And that rings true for all of our metrics across the site. What does change is sometimes the direction of those better outcomes is lower, and then sometimes the direction of better outcomes is higher. So for the case of children in poverty, for example, you of course want less of your children living in poverty. So this blue check mark in the circle will be on this end of the scale bar to indicate the direction of those better outcomes. This blue triangle indicates the dashboard city average, or the average for all 900 cities on the dashboard. And this gold bar here represents the city or the census tract value. So in the case of Charlottesville, 19.8% of the city's children were in poverty, compared to an average of 17.4% for all 900 dashboard cities. And this green check mark is present when the city or the census tract value is better than the dashboard city average. And because we're seeing that children in poverty rate is slightly higher than the dashboard city average for Charlottesville, we're not going to see that green triangle. And then scrolling down to the map, you're able to really see, you know, at a glance very quickly, the neighborhoods that are doing what better versus the neighborhoods that are struggling a bit more. And all of these, you can kind of hover over each of these tracks to get more information about the measure, the estimate, the zip code, and each of these tracks, you're able to not only hover over them, you're able to click into them. And just like we saw for those demographic maps, when you click into a census tract or a neighborhood, that kind of pulls it off to the side. So you're able to see, again, at a glance, how different neighborhoods are comparing to one another. And it hopefully helps you kind of just dig into, you know, what's happening in these neighborhoods. Why is, you know, one neighborhood right next door to another neighborhood? Why are the outcomes so different? And all of our maps and scale bars are downloadable. So you just kind of click this here and you can download them to use in presentations, reports, you know, social media. And it's all high-res images, which is really helpful for people.
Hey, Sammy, sorry to interrupt, but there's a question in the chat about the min and max. So can you just show the toggle between the dashboard city min max and the Charlottesville and what that means on the scale bar?
Yes, of course. So the default option is that the min and max on this scale bar will be for the city. So Charlottesville's children in poverty rates go between 0% in some neighborhoods, or in one or many neighborhoods, to 42% as the max. And then if you click, and I just want to show you the map here, and so this map is based on the Charlottesville min and max. The colors are based on that. But if we click here to the dashboard city min and max, you can see that range has changed. It's 0% as the min to 100% as the max. So there are some neighborhoods in some city on the dashboard that has 100% of its children living in poverty. And you could see the map of Charlottesville has changed, given that, you know, we have a larger range. We're seeing less variation between tracks or between neighborhoods in Charlottesville, Virginia. I hope that answers the question. If there's another kind of, you want me to go deeper, we can do that towards the end. And then just moving along, for about two-thirds of our measures, it's so hard to keep track of the different fractions because we're adding measures all the time. We provide our metric data by broken down or disaggregated by race ethnicity across the 5 major racial ethnic groups. And so typically when we don't have neighborhood level data available, we will have data available for the city for the 5 major racial ethnic groups. So you can see here kind of at a glance how different different racial ethnic groups are experiencing poverty, not only compared to the other four major racial ethnic groups, but also compared to the total Asian population or Black population for the 900 plus cities. So this is kind of helping us get that equity lens and not just, or looking at these challenges or looking at these issues that our city is facing, not just from that geographic lens, which we saw in the maps, but also from this racial equity or racial ethnic equity lens, which is really important. And just moving across the scale bar, Becky mentioned that all of our data or all of our measures are taken from national data sets, which helps us kind of compare across places. So we know that children in poverty measured in Charlottesville is measured the same way as children in poverty measured, or children in poverty in Brooklyn, New York, or New York, where I am now. And so the dashboard allows users to compare cities in two different ways. One being, you could just enter your city in this search bar, and I'll just do another Virginia city, Alexandria, for example. And so when we enter that city, that new city's scale bar is kind of pulled under the Charlottesville scale bar, so you can see how the two cities' poverty rates compare to each other. But perhaps, if I'm a Charlottesville, I work for the health department in Charlottesville, and, we're always compared to Alexandria, but Alexandria is much larger than Charlottesville. It's much more diverse than Charlottesville. It's not really a good comparison. We have this, this filtering criteria where, as the user, you're able to kind of pick your own filters on what you want to compare or how you want to find comparison cities or peer cities. So you can do that by population size, for example, location. We can do, the adjacent states, and then we can also look at cities perhaps with a similar Black population. And so as I kind of was toggling and increasing my filtering criteria, the number of cities has kind of been filtered down. So I can choose, for example, let's just say Burlington and Kannapolis. And so by clicking into those, again, we're seeing those cities' scale bars, or that city's performance pulled under. So we're able to see how each of these cities compares to one another. And then perhaps, that can help us think through, okay, what's happening in these cities? Have they implemented certain policies that are working that we can maybe implement in our city? Are there people that we can reach out to in those cities to kind of learn from them and kind of have some thought leadership or some collaboration to implement programs or policies in the city that we're working in? And then we also have the ability to compare metrics. A lot of the measures that are on the dashboard, a lot of the issues that we're all working in, they're very large and they don't exist in a silo. They're complicated. And so we wanted users to be able to see how measures could or could not move together in neighborhoods of their city. So, we can look at children in poverty here, and then perhaps we can compare that to the diabetes rates in Charlottesville. And so just another note, like I said before, lighter colors mean better outcomes, darker colors mean poorer outcomes. And on this map, you can see those blue polygons, or those blue shapes, indicate our original metric. So in this case, children in poverty. And these red or these pink dots indicate our comparator metric, which is diabetes. And so you can see in these, for example, in these neighborhoods in the south part of the city, the neighborhoods where poverty is higher, diabetes rates tend to be higher as well. So again, we're seeing patterns of how these measures may move together or how residents living in these neighborhoods could experience these two challenges kind of together. And then we also provide this data kind of shown in a scatter plot or in a graph view. And each one of these dots indicates a census tract. So you can click into those census tracts and you see the rates of children in poverty compared to the rates of diabetes for all of the tracts in that city. And then Moving along to take action. This is one of it's one of our, I think, our most powerful parts of the site as well. We heard a lot from users when we first started the dashboard back in 2018, is that, they got all of this information from the dashboard, but they wanted to know, what's next? How do I actually put this data into action? And so we have what we call the Take Action Center, where you're able to see these 5 buckets of resources to help you actually move the needle on an issue that you identify on the dashboard. So we have the what you can do, so the policies and programs that are available to you, very straightforward stuff. We also have find partners to help you identify, who can we maybe bring into the conversation, who can we extend seats at the table to help us, work through these challenges. Strategies, we have various tools to help you communicate data to your residents, how to effectively communicate effectively with your residents, how to advocate to your local policymakers, things like that. We also have funding resources to help you not only identify potential funding resources or funding buckets for your ideas, but also we have tools to help you actually apply for that funding and kind of how-to guides for applying for that funding. And then finally, we have a bunch of resources that are focused on helping us measure our impact and making sure that the outcomes outputs that we're expecting to see from our policies and programs are actually what is being felt by the local community. And so for the Take Action, you can access that in 2 different ways. So the first being from your city's navigation bar. And so once you click into a metric, and then you go to the Take Action Center on this navigation bar, all of these resources, where kind of applicable, will be filtered for that metric. So for example, all of the find policies and programs will already be filtered for children in poverty, versus if you access Take Action from the main menu here, this will be our kind of full list of policies and programs, and then you can choose the metrics that you want to filter by. So children in poverty, diabetes, you can enter that here. And then just some other features that we provide. We have a very active blog on the dashboard. We're always adding new pieces, new content to the site, which just helps us kind of look at the data in a different way. So you can find all of that here. And then we also, I want to mention, hold on, that we have a lot of great pieces about specific metrics. We call these blogs behind the metric. And so I just entered high school completion here, for example, and you can see that we wrote a behind the metric blog that kind of goes into, how do we measure the metric? Are there any kind of caveats or tips and cautions that we should think about when looking at the metric? And really just breaks down the data into a way that's kind of consumable for a lay audience, and helps us. It's just a more practical, interactive way to look at the data. And then before I move it or kick it over to Becky to look at data access, I do want to mention that we are always having or always kind of hosting events, whether it's conferences, webinars like this, virtual office hours, which are very similar to what we're providing here. And you can access all of that and just different opportunities to connect with our team through the events portal. And like I said, virtual office hours are very similar to what we're doing now, but they're informal webinars where we'll go over the dashboard, we'll do a demo of the site, and then we'll go into a topic of focus after the demo. So Becky mentioned that we're adding 2 metrics in September, and those metrics are actually firearm homicides and firearm suicides. So our September virtual office hours will focus and kind of explore those 2 measures. And so we host these every month. Typically, we have some off months, but mostly every month you can expect to have a virtual office hours that will host. And so with that, I will stop sharing and we'll pass it over to Becky.
Great, thank you, Sammy. Let me pull this up quickly. So I wanted to just also show how to download the data and use it in some really basic ways. So obviously, we hope that you are able to, use the dashboard interface for a lot of your work. But downloading the data is really powerful, no matter kind of what data skill level you're at. So I just wanted to show how to do some basics here. So you can get to this from many places on the site, but right here in the menu is the Access Dashboard Data. And I have already filled out the form, but there's just a little data use agreement that pops up here. So don't be deterred by this. It's just quick to fill out, and it just helps us understand who's using the data and for what purposes. And then we can reach out to you, like if we find an error or we update something, we're able to contact you there. So then once you fill out the form, you get to this data access page. And it explains that the data comes in basically CSV files that you can use in Excel and other programs, or you can access the data through an API. If there's questions about how to use an API, it's essentially a back-end tool that pulls data right from our system into whatever system you're using. I will have to send you to one of our data team members. But what I wanted to show here is how to download the data just to do some basic things in Excel. So there's a lot of information here. Our technical document, if you're interested in such things, describes everything about the data and the metrics and our technical decisions behind that. And then down here is where you can actually download the data. So we have the entire dashboard city data set, which is very large, which you could go here, or you can download the city data by state, which is what I would recommend for general purposes. So for example, once you click on, I'll just do New Jersey because that's where I am, it downloads a zip file. And when you open that, you can access the data through text or CSV. So if you're using some programming tools that you want to pull the data into, you can do that, but you can also just open the data as a CSV to get a lot of information. And we don't always cover this, but I think it's important for beginner users of the dashboard to know that you can do this. So just as an example here, so you can see that there's an Excel file for the city level data in New Jersey and then the tract level data. So I'll just start with the city data here. And again, I know this is getting into some deeper things, but I just wanted to show you the important pieces here of this file. So with a quick filter, which I can't do right now because this is in the way. Okay. So I'm just going to put a filter here. And again, this is basic stuff. So if you're an advanced data user, you can zone out for a second. But if you're on my end of the data spectrum, I hope this is useful. So now with the filter, we can sort, for example, we want to look just at Hillsborough. So we can pull up Hillsborough, and then here are all the metrics. And the column that we're really, that gives the data value is the estimate column here. And say you want to just look at, let's just start with diabetes. So because this is, here we have the city level value because we are in the city file. And we have the estimate is 7.4 for diabetes in Hillsborough. But then say we skip to high school completion. And this is where we get the demographic breakdowns. So it's still city level, not census tract, but you can see the values for the Asian population, Black, Hispanic, White, and the total population. And the other is the other racial ethnic groups. And then we also have female and male. So you can like put them in order that you want or just pull the values that you need, but it's just a really quick way to get them. And then if you, let's see, we'll go back and I just want to quickly show the tract data. Same thing there. You can put a filter on that top column. And again, we'll filter by the city Hillsborough, who I think is on the call. Welcome, Hillsborough. Okay, and then again, we are interested in this estimate column. And let's again just take a look at diabetes first. Okay, so here we're seeing the different tracks in Hillsborough, the different neighborhoods. And these columns are the geographic identifier columns. So this is where we're seeing the track ending in 53703, 704, and those will align with the tracks that you see on the map on the City Health dashboard. So you can get those individual neighborhood level values and go through different metrics that way. So again, that's a little bit more of a deep dive than we usually do on the downloadable data, but this is my level of interacting with data, and I think it's really helpful just to show what you can do with those immediately downloadable files, and then of course you can import the data into other programs as well. I'll turn it back to you, Sammy.
Great, thanks for that little tutorial, Becky. More than I can even do with our data. So I will go back to sharing my screen. Let me just make this larger. So now that we kind of have explored the website and the information that we provide, I thought it was important to kind of share to highlight how local communities across the country are actually putting our data to use for their residents to improve health and equity, and kind of looking at what our impact is. And with the hopes that it maybe inspires you or helps you kind of come up with ideas that you could start doing in your community. And the first one that I want to go into is from Clifton, New Jersey. And I know Rebecca in Marietta, Ohio is also in the process of applying for public health department accreditation. And so this is what I mentioned to you earlier that might be helpful. And so this is a video that we recently created from using a user named Jennifer in Clifton, New Jersey, who is working at the health department in her city on their accreditation application for their health department. And she used dashboard data, and we'll see how that kind of came into play in their city. So let me just press play.
I honestly think that without City Health dashboard data, we would not have been able to produce the community health assessment that we were able to publish. The city of Clifton is one of the largest municipalities in the state of New Jersey. We are located in the New York metro area, 13 miles west of Manhattan. Clifton is one of the most diverse communities, not only in the state of New Jersey, but in the country as a whole. The most important documents that are required for accreditation are your community health assessment and your community health improvement plan. My health officer and I were so excited to hear of the City Health dashboard because it had been such a struggle to find municipal level data for our community health assessment. And so when we found out that we were included in the project and that all of these indicators and measures were being collected for the city of Clifton, it was like striking gold. So we used almost every measure that City Health Dashboard had available at the time. However, we were especially interested in those measures that gave us census tract level data, such as children living in poverty, obesity, the uninsured rate, and those able to seek preventive services. The census tract level data with the color-coded maps are especially easy for someone to navigate the dashboard's website. We were really excited when we finally published our community health assessment because we were one of the few municipalities in the state of New Jersey to be able to produce such a robust assessment. We actually even submitted the assessment for an award to the League of Municipalities here in the state of New Jersey, and we won the award for one of the best publications from a local health department. The data in the community health assessment was so compelling that it finally convinced our policymakers and decision makers to approve funding a satellite health office in an area of the city with great need. Definitely recommend City Health Dashboard to any community that is conducting any type of assessment.
So yeah, I just love that video because as we've kind of spoken with users over the last, 4+ years of kind of being in existence, the community health assessment, community health improvement plan has come up time and time and again, where cities they need data, but they don't have have not had access to that city level data to kind of identify what are the actual challenges that my community is facing, and how can I, as a health department or a hospital system, where are those areas where I can really make a difference? And so this is just emblematic of a very large use case that we have identified, and perhaps that is something that you are working with or you are working on in your city, and the dashboard data can be helpful to help you meet those goals.
I honestly think that without
sorry.
City Health dashboard data.
And then the next impact story or use case that I wanted to highlight was a collaboration that we had with the New Jersey Health Initiatives back in 2019 and 2020. And we have a lot of New Jersey folks on the call who might be aware of NJHI, which is the New Jersey grant making arm of the Robert Wood Johnson Foundation, who was our funder as well. But back in 2020, we worked with them on a grant to provide data for 10 small communities throughout the state of New Jersey, all with population sizes of 4,000 to 50,000. So this was actually the opportunity that we had that kind of inspired us and made us think about, how can we continue to provide more data to more cities, particularly at those smaller levels. So it gave us the idea to actually launch the Put Us on the Map challenge, which we are all here for today. And so this was, like I said, we provided this data to NJHI for 10 small cities, and these city teams were comprised of pretty cross-sectoral groups. So I think there were universities involved in this project across the cities, health departments, local policymakers, there were fire departments involved. So it was really a cross-sectoral collaborative initiative for people from these different teams to understand what their challenges were, but then also create solutions that were grounded in data. And so I'm just going to highlight the Glassboro team. So the Glassboro, New Jersey team was kind of formed around a local university there, Rowan University, and they had identified poverty and access to healthy foods as top challenges for their community. And the data that we provided to them on those two issues really matched what they were seeing kind of anecdotally in the community. And so these teams that were comprised of grad students, undergrad students, university or professors, community members, they use the data to help them, perform outreach in high need communities, administer surveys, have interviews and focus groups to understand not only how food insecurity affected residents, but how food insecurity and poverty related to each other and perhaps exacerbated those issues. And so from all of that data collection, they were able to create recommendations to present to the city, to the Glassboro city policymakers, I think it was their city council actually, on how to improve food access. So they came up with training of certified health coaches who would operate in community centers or community kind of hubs, such as places of worship, where they could offer coaching for residents, but also training to residents on how they could grow household gardens in their backyards as a way to get fresh produce versus having to spend money or more money at the grocery store. So that is just another example of the dashboard data in use in a small community. And so with that, that's how other communities have been using the data, but now we're so excited to be able to provide this data to everyone on this call and see what you guys come up with and what solutions and programs you guys are able to put into place in your community for your residents. And so with that, Becky mentioned this earlier in the call, but here's what you can really expect from us. We want the lines of communication to be very open with everyone on this call. So, and we want to support you in any way that you want to be supported. So if you need technical assistance on site navigation or how to download our data or understand our data, we are here to help in that, in kind of whatever capacity you need. I mean, I'm already, I think I have 2 meetings or 2 similar demo presentations set up with cities on this call for their team members who are not able to attend this webinar in the next few weeks. So if that's something that is, of interest to you for your team and your city, please, please, please do not hesitate to reach out to me and let me know if we would want to set something up like that. Communications and best practices. We talk about data and we visualize data a lot at the City Health Dashboard, whether it's for our news, our newsletter, our blog, our social media. And so we have kind of figured out how, what are the do's and don'ts and lessons learned for talking about data, particularly with lay people and community members. So if that's the support that you need, please reach out to us. Also, networking with other communities. Of course, the folks on this call, we can connect anyone to the other Put Us on the Map cities, but also, again, Rebecca in Marietta, you are working on accreditation for your city. Perhaps, there's some you want to learn or you want to hear about that process and what Jen went through in Clifton, New Jersey. We're happy to make those connections and make those contacts with anyone that we kind of have a relationship with. We have a relationship with a lot of different cities and organizations, and we're happy, again, to make those connections. And next steps. So the data, like I said before, has been live for about a month now, but explore your data, explore the site, kind of identify where those challenge areas are, where those opportunity areas lie, where is your city doing well, where can we kind of highlight our successes, and just explore the different features that I highlighted today. Sometimes those features can be kind of hidden in the site, and but they're really powerful ways to put the data into action. And then, like I said, reach out to us with any questions. My email is on this slide, and you have my email in your inbox as well. And then just keep us updated, not only, as, staffing changes in your organization, but, as you're using the data and putting it into practice, we want to know, what's working and how, what the impact it's having in your community. Becky mentioned perhaps, highlighting that work in a blog or an impact story when the time is right. And we want to be able to highlight the amazing work that you guys will do with our data. And then lastly, just opportunities to engage with the communities on this in this cohort. We plan to have quarterly opportunities like this that are interactive. What that looks like is TBD, but you can expect to hear from me in the next couple weeks, months on what those opportunities will look like. But we're hoping to do something along these lines on a quarterly basis.
And Sammy, I just want to hop in here to say, we love to hear the good stuff of what of how you're putting the data to work, but also if you're having issues, if something is just, a feature is just not serving you right, we're always thinking about how to improve the site with new features, new data. So we're happy to hear all of that.
Totally. And then, yeah, this is just some opportunity or just our info to stay in touch with us. Our general email, our Twitter, and we can open it up now. I think we have about 15 minutes for questions. I know that there was some in the chat that people have gotten to, but in case there's anything else, either, put it in the chat, take yourself off mute, very informal. And let me just check the chat to see if there's been anything that hasn't been replied to. I think all of the questions in the chat have been answered. So again, if there's anything you want to ask, feel free to take yourself off mute.
Hey, this is Rebecca. I just wanted to add, again, thank you for this opportunity. And I am looking forward to connecting with Andrew from the City of Athens because they are a city-county health department. And I am going to be reaching out to you, Andrew. So just kind of seeing how you all did with your I mean, we're the city health department, but Washington County Health Department, but with the CHA and the CHENAs and the stuff like that for the, and the chips for the accreditation processes, that was a challenge of trying to combine two different sets of statistics. So I'm anxious to see how they particularly did theirs, especially with them going to be involved in this as well.
Loving these in real time connections.
And just on that point with city and county data, so we kind of consider ourselves like a sister tool to the county health rankings and roadmaps. We have the same funder. We meet regularly with them. Our measures are some are measured in the same or come from the same data sources, and some are a little different. So if you're dealing with any of that, we can help walk you through some of that as well. But really great data there on health and the social determinants of health. If you're really just looking at the county, and then if you want to get into some of those city and census tract levels, you can turn to the City Health Dashboard.
And then this came to me from Jenna in Freehold, who asked about the dashboard team doing a presentation focused on their data for a community meeting, for example. And to that, like, yes, we are totally game and available to do that. If if any of your cities have community meetings that where your local policymakers, your local community would like to see their data in a similar way that I kind of showed Charlottesville on this call, we are happy and eager to do that as well. And then we just got a question from Leslie. Is there any way to get statewide data on the same data points to compare a city to? I'm going to say yes, just because I know that the state data exists, but I will maybe have one of my data team members who can talk about the actual data sources that exist for that state level data.
Hey, Sammy. Hey, everyone. My name is Ben Spohr. I manage the data team here. I guess I'm the highest on the nerd totem pole at the dashboard, but some other members of my team probably know these answers better. So if y'all want to jump in, don't hesitate. Leslie, it really depends on which data point you are concerned with. Some of our metrics are presented as reported by other data sources like ACS, the US Census. And so that you can probably, if you can navigate the census website, which was designed by someone who's never seen a website before, then you can just grab it. Some of our ACS metrics, we do some calculation and manipulation, and so you would not be able to get that exact data point. And then other data sources have different levels of availability. What I would suggest you do is wait till January when we're going to launch a whole other website that will, I've been told, involve some state data. That's an inside joke for Becky. We're going to put state averages on our next website, which is a congressional districts focused website, and we will have state level metrics to compare it to. It will be a little bit annoying to have to go to this one website to get the state data and then go to this other website to get your city's data. So we'll take this back and think about trying to add some of this state level data to the City Health Dashboard. So the short answer is it varies. The long answer is you can probably get it if you are willing to click around the internet a little bit more and you're willing to wait till January.
Thank you. And just to kind of piggyback off what Ben said and what Becky had kind of looked at when she downloaded the data set for Hillsborough, by using the downloadable data or our API, you're able to integrate that with any other either locally collected data that you might have, statewide data, and you're able to kind of see those things kind of more easily side by side if you're able to do those downloads and the API as well. And then we got a question from Susan. Is the data on this site similar to the data on the NJ Shad website? That's also a great question. Very inside baseball for our data team. And I will let Ben take that one as well.
Yeah, so in some ways it is, Susan. The vital statistics metric estimates for the small New Jersey communities that Sammy talked about were drawn from NJ-SHAD. And they were drawn from NJ-SHAD using methods as identical as possible to the methods we use to generate our vital statistics measures for places that aren't smaller New Jersey communities. So similar is probably the most accurate way to describe it, because we were sort of very careful to closely replicate the methods across those two groups of cities so that they would be comparable.
We can connect more offline, Susan, if you have more specific questions about NJ-SHAD.
Okay, we're almost at time, but we probably have time for one other question. We have something from Brittany. For the metrics that aren't available, will those be added later, or does that mean a data source isn't available? For that question, kind of both of those things are true. So just off the bat, there are some data sources that we currently have for our larger cities that just don't have the data for smaller cities. That's for some data sources. We have other data sources that we will be able to provide the data for the smaller cities, but we'll just update those data or update those metrics for you guys once we kind of update the data for all of the other cities. That so all of our data sources are updated at different times throughout the year. And so as we kind of go through that schedule, where possible, once we update the data for our larger cities, we will add also the data and the metrics for the smaller cities as well.
And just to add there, we will, because you're kind of a special set of cities, we will try to communicate with you when there are changes, but make sure you are subscribed to our email list. I just put the link in there, and I think it was in the presentation somewhere, so that you do get the emails when there are other site updates. But we'll also try to be directly in touch if it's something that really impacts your data availability. Any final questions that we can address today? Okay, great. So we are really excited to, again, have you all incorporated into the dashboard. Please feel free to reach out. You'll be hearing from us as data availability changes, or we have opportunities to connect with each other or hear about a new feature or something we've added to the site. But otherwise, reach out with questions, issues, more praise of the data. We love to hear that too. And we'll be in touch soon. Big thanks to Sammy for not only coordinating this challenge, but walking us through everything today, and for the data team for making this happen.
Yes, thanks everybody. I will stay on for the next couple minutes in case someone was shy and wants to ask a question when there's less people. But thanks for joining us.
Hey, Sammy, it's Rebecca. I am interested in trying to get, I guess I didn't realize that there was an opportunity to do like a group setting with the staff here for those, like for the nursing department, in particular. So just, we have a staff meeting planned on Tuesday, so I'm going to run that by them, and then I'll be in touch with you guys, you and Becky, to see what's going to be available for you all to try to do.
Great. Yeah, let us know. And if it doesn't work, because it's Tuesday is pretty close. If it doesn't work for this Tuesday, we're happy to come to your next staff meeting, whatever works. But hopefully the timing works for us in our schedules.
It'll probably be sometime next month, because like I said.
Oh, next month. Okay.
Yeah, because we're scrambling on documents, getting documents uploaded and stuff right now. So if that's a possibility, I'll be working on that.
Yep. Great.
All right. Thanks.
Thank you. Okay, so we are at 3:01. I'm gonna end the meeting, but thank you all for joining us today. And as always, you can reach out with any questions, comments, after the call.